Welcome, everyone. I'm Meredith Goldstein. I'm the advice columnist for the Boston Globe, which means I write a lot about relationships, the good, the bad, the complicated. I'm so thrilled to be here today to moderate a talk with filmmaker and palliative care physician and advocate, Dr. Jessica Sitter. I'm also selfishly grateful to be here because watching Caregiver A Love Story, it was very therapeutic for me. Those who read my column might know that I lost my mother to cancer in 2013, and she was treated at MGH and diagnosed at stage 4. And when we were, my sister and I were her primary caregivers and caretakers. And I think going into it, we didn't quite know what that meant and what the role of a caregiver is and how ill prepared we were, not just because the world doesn't have a structure of support. So watching this short film was incredibly familiar. I felt incredibly seen, and I'm sure many of you did too. And I just want to thank you for making this, just to start. And one of the first questions I have is that this is about choosing subjects, right? This film, so much of it is about being able to find someone and a couple to really give you a sense of the realities of this, because so often when we see what it means to end a life in a film, sometimes even in a documentary, it is this very, the music swells, this is, there's this the cinematic end of life, and then there's a reality. How did you find two people who were willing to give you this kind of access?
Well, first of all, I knew them. They're members of my synagogue, and I had been watching them sort of from the periphery. They knew I was a palliative care doctor, and I knew that Bambi was sick, and she was sharing a lot with me. We actually were also colleagues. We worked in the same hospital. She's a physician assistant. Um, and I was just watching this sort of drama unfold with her. And the thing you need to know about this film is that it wasn't supposed to be about family caregiver burden. The reason we started filming in Bambi and Rick's house was because, number one, Bambi was who Bambi was. She was this amazing, welcoming person who wanted to help other people. And she said, if my story will help other people, I come in and film, come in and write about me, do whatever you want. And we thought this was going to be a film about a good death at home and how beautiful it can be. I mean, I, as an ICU and palliative care doctor, see terrible deaths in the hospital all the time. And so I had this idea that a death at home that was planned and where hospice was involved was by rights going to be positive. And so what happens in this film was a surprise to me. I didn't expect that it was really going to be about Rick. I thought it was going to be about Bambi. And so I think that's a really important thing to understand. The surprise that I felt is the same surprise you felt in 2013 when all of a sudden you were like, wait a minute, what's happening? There was an unnamed and it was unexpected.
And I'm sure it was a surprise to Rick as well that that he became a focus. And it used to be that I remember when my mom was sick, we heard palliative care and we bristled. We got scared. That to us meant while she was being treated, we are giving up on a process. We are things are not going well, right? And once we finally got there, I had wished we had gone in much sooner because what it meant was something different. Do you feel that over time, and especially as we're having more conversations about this, that people are reinterpreting what it means to seek palliative care, to give palliative care? How do you define this for people who just sort of want to put blinders on and say, I don't want to hear that phrase?
There's been so much progress, and yet there's been so little progress. And I know that sounds cryptic, but the fact is we have a marketing problem. People don't understand what palliative care is. People associate palliative care with hospice and with death. Totally need to decouple those things. It is not true. Palliative care is the art, the science, the medicine of relationship building. It's about taking a person and their family and figuring out what they need. It's not about death. It's not about withholding or withdrawing. It's about maximizing quality of life. Many, many people get palliative care who live for years. And so this automatic coupling of palliative care with death or with giving up is false. And that falseness and that sort of expectation that, and in a way, poor marketing, maybe on our part, has robbed so many people of support that really could have enhanced the quality of their life for as long as they were going to live, which could be years. So it's a big problem.
Well, I think it's interesting to talk about it as a marketing problem, and to think about how it's even being discussed as being very different. One of the things that struck me was about Rick's own health, and it's something that I had not known, right? The sort of what it does to a caregiver, to be a caregiver emotionally and then physically. And, has there been a lot of work done or any work done to talk about, it's often the people who are doing this kind of care that get sick very quickly because of the burden, because of the lack of sleep, because of the worry. Um, what do we know about that, beyond this anecdotal example?
Well, there is a rising body of literature. There's a lot of groups and people who have been doing research on this for a while, and their voices need to be amplified. And we're hoping that this film will help to amplify their voices and their work. But there is a lot of data out there that really does definitively show the profound consequences on caregivers, financial, emotional, and psychological, and physical/health. And people are really, in fact, of caregivers who take care of demented patients with dementia, I believe that the number is 30% predecease the patient. I hope
Wow.
that's correct, but it's a very high number.
Wow.
Very disturbing. There is a profound drop in the healthcare and health status of people caring for other people, and it's partly related to the stress and the lack of ability to go to your own doctor's appointments. And there's a real problem with just following up with preventive health for caregivers. They let themselves fall by the wayside as they're caring for this person. And it's definitely, again, a public health crisis that is not going unnoticed, but really needs to be amplified so we start to do something about it.
I just want to remind everyone that there's a Q&A space at the bottom of the screen. So if you have questions, please drop it in, and we can get to them as they come in. You make a choice, and obviously this is because the focus shifts, right, from a movie about a film about death to a film about caregiving and sort of what that means to catch up with Rick after the fact. And I wondered, I mean, I didn't know where we might find him, right? And were you surprised to see what his trajectory was after? Because he brings up a very specific point that I think a lot of people don't like to talk about, which is that when caregiving is a big part of your life and then there's the absence of it, what do you do with that space? And where is the grief in all of this? So can you talk a little bit about how you followed him after losing his partner?
When in the film, Rick says, after Bambi died, I really couldn't do much for a year and a half. And I'm going to admit to you that I thought to myself, wow, that seems a little extreme. And I will tell you something. Every single person I know who has watched this film and has worked with family caregivers says this is a reality. People are in some way traumatized by the experience psychologically, and there is there's loss and grief, and of course that's one element of it, but there is this sort of numbness that many caregivers experience for a long period of time that follows them along. I think there is something in the caregiver experience that incredible loneliness and profound stress on a person, and then the person is all of a sudden not there, and this role that they've kind of become accustomed to, however hard it may be, is suddenly evaporated. I think we're not providing the support for those people that they need. And the more I'm learning about family caregiver burden, the more I'm seeing that this sort of long tail of psychological distress follows people in ways that I think are very serious, and ones that we need to understand better.
So, we talk a lot about a broken healthcare system. We talk a lot about what people should be entitled to have as humans in order to be healthy. I'm not asking you to fix this in one Q&A, but where do we begin with this kind of conversation? Because to me, it's there's the community aspect of it, but there's also just the absolute public policy of it all, and what should we be entitled to as humans in the world.
Oh, yes. I mean, when you think about all the systems that are involved in the experience of a family caregiver, there is the sort of social network and all the policy and laws that exist locally and a community, federally, et cetera, the support that's out there that's been approved by various legislatures around the country. That's one thing. Do those resources exist? Are they out there? Can people access them easily? Can people qualify for them easily? That's one sort of system that needs to be thought about. But then there's the healthcare system that where I live. And here I am, this, longtime palliative care physician who thinks about patients and holistic approaches to taking care of people. And the fact that I really wasn't aware of what happens outside of the hospital until this film came along and showed me is alarming. If I didn't know about this as a healthcare provider who cares about managing patients and their families and supporting them, then who the heck else doesn't? And what our health systems really focus on the patient, and we really don't think about the caregiver. And I think that that's got to change. The integration between those two systems, right? The out in the society, the social systems and social support that exists out in society, and the healthcare system. The healthcare system's a magnet for family caregivers. There's tons of family caregivers around, but we're not necessarily identifying them, assessing them, and then connecting them to the stuff that's going on outside in their community. We should be bridging. We should be a consolidator of family caregivers and then figuring out how to connect with the outside resources so that we can then have these handoffs going on all the time. But we are sort of like the hospital on the hill, and we're not thinking about what's going on in the community. That's got to change. The healthcare system is intimately involved and should be intimately involved in the experience of these caregivers. They're all our future patients, and they're coming at us faster because they're so debilitated in their own way. Then there's the employment system. Most people get their insurance through their employers. Many family caregivers are also working. Many, I think more than half. We've got family medical leave. That's 12 weeks of unpaid leave. Clearly, that's not enough. Most people, Rick did this for 9 weeks. The average family caregiver does this for 4.5 years. How is 12 weeks a year of unpaid leave going to help a family caregiver? And I think that there's got to be some coordination with the world of employment, the system of employment that really makes it possible for family caregivers, as we all filter in and out of being family caregivers, which we all will, to really have this system working again in concert with the existing resources out in the community, with the healthcare system. We've all got to be coming together. And as you say, the community around these caregivers, we've got to be lifting up, recognizing who they are, not kind of keeping them in the silent role. Oh yeah, he's just the husband. Of course he's going to do that. He's going to take care of that. Oh, she's just the daughter. That's her role. We've got to understand, oh no, this person's a family caregiver. We've got to raise this person up. We've got to anticipate the fact that they are going to be struggling. And then we need to come in around them and do the things that are going to be supportive.
I mean, I think a lot about how lucky I was to have the Globe, and still am. And I think I probably didn't understand how lucky I was at the time that I was working for a company that was run by people who were like, it's your mother, go do that, go be there for her, and to work with me and letting me work from home. And most people don't have that option, right? And also this seems really relevant right now, because when COVID began, there seemed to be a crisis of childcare, and I don't have children, right? And I'm a single person, and I'm looking at my friends and my colleagues, and they have children crawling all over them, and they don't have help, and no one can come over and help them. And all of a sudden, there was a real lens on, oh, this thing that we just took for granted that just happened elsewhere. Like like we have to stop. So do you feel like some of the stronger visibility of what it actually takes to be a human in the world and to care for people you love, whether they're dealing with an illness or not, that we might have a better understanding of that coming out of this?
Yes, I sure hope so. I sure hope that this lens into this world of caregiving and the I mean, it's caregiving on steroids, right? Because not people are sandwiched between their parents or people that they're worried about on this end, and then their kids. And there's this incredible just magnification of this experience that is dreadful. Adult day center programs for elders are being closed down. Schools are being closed down. All of a sudden, this pressure on these caregivers, which is already so huge, has just exploded. There was an article in the New York Times that talked about women leaving the workforce because during COVID, because of caregiver burden and responsibilities. And it was at a rate of 4-to-1 over men. And what they said, they called it a she session. And the final takeaway was this could make give women a 10-year delay in their professional advancement. So that's women. But then you think about all the other people who, in every social situation in our country, are most stressed. And minorities, same story with COVID. I mean, and with caregiving in general. But again, magnified by COVID. Much more likely to lose jobs, much more likely to be providing care to more than one person, much more likely to be providing care while a student. Think about all these extra stresses for minorities, which are exacerbated by COVID. And my hope is that, as you say, we'll come out of this with more empathy and more of a ability to see this as a threat to our own individual lives, and a desire to say, wait a minute, this is a situation that must change.
We have some questions from people in the audience. From Elaine, how much of the caregiving problem is the lack of financial support to provide relief for the caregivers, and is hospice funding to blame?
Mm-hmm. Well, it's funny because I watch people's responses when they watch this film, and people want to find somebody to blame. And who's in this film? In this film is the character of hospice, and it's the character of Bambi's family, her sons. And I hear this, why wasn't hospice more available? Why did her sons leave? And I will tell you, in both of those situations, the sons left because they had both of their wives were pregnant and about to deliver, and they lived in Israel. They had to leave. And I'm not making excuses. I'm just saying that we're looking for some place to blame than the others. Why wasn't the hospice more available? And if you see in the film, my mouth drops open when Rick tells me how little time he's getting from hospice. I think first of all, let's just remind ourselves that for most caregivers, hospice isn't even in the picture because their care recipients aren't qualified for hospice. Most care recipients aren't actively dying like Bambi was. So hospice isn't even in the picture. But for that subgroup of caregivers for whom hospice is in the picture, there's this expectation that hospice takes care of everything. I even had it. I assumed that hospice was going to help with changing Bambi's diapers. Why should Rick? I said to Rick, that's not your job. Well, whose job is it? Hospice gets paid $150 a day. They're coming in, they're managing all the durable medical equipment. They're managing, bringing in the nebulizers, bringing the medication, making sure that the family caregiver knows how to give morphine, how to do these kinds of things. They're available 24/7. That is what the hospice benefit is for. They're not there to do housekeeping, clean out the refrigerator, do the laundry. They're maybe going to be able to help give a bath here or there if they have time, but that's not what the hospice benefit is. And I think our cultural expectation that, well, hospice is there, why is this all lacking? That's not what hospice is there to do. We've got a whole bunch of donut holes that are missing here that are not part of the hospice benefit that must be thought of and considered when we think about what are our priorities in this. We have to provide that, whether it's in addition to hospice or we pay hospice more to provide those kinds of services, I don't know, but it's not that's not what hospice's purview is.
No, that makes sense. This is a question from Barbara. Is this education included in college and post-grad courses for doctors or medical workers? So, I mean, this, leads me to go back to what you were saying about not knowing what's the education component of this?
Well, thank you for that question. We are right now have created a program for medical students. I mean, it's a start. There's many healthcare professionals that should see this. I think the film is a great vehicle because it's short, it's 24 minutes. You can get some awareness raising about the issue of family caregiver burden in 60 minutes. And a lot of programs are happy to have a 60-minute program. So we're trying to get the film with a little bit of wraparound programming. It's not the most intensive amount, but it's an introduction to family caregiver burden. And a lot of, we're starting to work with a lot of different medical schools. If anyone on this wants to talk about piloting it or using our program, we really would like to get some awareness. We're talking to end-of-life doulas. We're trying to talk to nurses. We'd love to do interprofessional education. We are trying to figure out how to do a program for hospices so that we can, I mean, hospices have probably more of an awareness of this issue, but they should really be thinking and strategizing within their own individual hospices. Like, what are some things that we could do that might just little things that we could do that might ease the burden of the family caregivers that we work with as well. So I think there's a lot of room for education. And the thing I love about short films is that you can bring them in, they can raise awareness, and they can make people interested, they empathize with the issue more and want to learn more.
There are a few questions coming in about Rick, and so if you can answer them,
Sure.
I don't know how much you wanted to keep private, but there's a question about Rick's line of work and about how understanding his employer was at the time. And also there's questions about how he was coordinating care while caring for a granddaughter as well. Just sort of how this was working. And not to put too many questions on. Also a question about Rick's rabbi and sort of the role of religion. How strong was that role and what influence did that role have?
Yes, great. Okay, so let me make sure I remember all three of these.
Yeah,
But the first one, Rick's an actuary, and he was self-employed. I mean, he was a consultant. Excuse my my cough. And so Rick had the most flexible work situation you could probably imagine, and he still couldn't really, as you hear him say in the film, he really couldn't get much done. So I think he's so that, I guess that answers the first question, which again highlights the fact that people who have more rigid work situations are even less likely probably to be able to keep working. In terms of the second question, well, there was the question about his rabbi and his religion, and Rick is very community focused. And part of my original intent of this film was to say, hey, look, look how great it is to die with this supportive community around you. All these people coming and caring, and a rabbi and prayer, and those were all really important things to Rick and Bambi. But again, and our synagogue and community, faith community is very strong and very supportive. And even in that scenario, there were things we could have done better. And our rabbi, we actually did some filming after 2 years after Bambi died, of Rick and me and the rabbi talking about sort of what is the role of a faith community in supporting family caregivers. And a rabbi who was very young at the time, I don't know if you could tell in the film, but he was very young. This was, I think, his first real, I think he had been with us less than a year. And it was, I think, his first rabbinical job. And he's wonderful. And he said, what if we had, we're talking about like starting committees. We have lots of committees in synagogues. Let's have a family caregiver committee. And we talked about theoretically about what could we do to recognize, identify, assess their needs, and then support them. And I think there's just so much more that we could do if we get organized. And I hope we start to do that. The second question, I did 1 and 3, but there was the second one. What was the second one?
Oh, it was about sort of balancing having a grandchild to take care of as well.
It was, all I can say is it was profoundly exhausting and not uncommon. I think that a lot of caregivers have these types of competing demands.
We have a question that came in about what care is like right now. Understanding the limitations of who can be where, and how has COVID affected the entire caregiving industry, because and the people who are paid and can be paid to help, and what access anyone has to vulnerable people.
It's a really tough, as you can imagine. People are being so protective, especially of people who are sick or who are disabled. And so a lot of the people who were coming in, possibly, if you were lucky enough to have outside support, a lot of people do this work without any outside support. But for those who do have some outside support, many people cut that off. And so the caregiver then became the sole person caring for this care recipient, and continues to this day. In the beginning, there were many hospices that were didn't have PPE. And I mean, it's just not a safe situation for nurses to be coming into a house if somebody was a care recipient who developed COVID. And there were plenty of situations like that. Eventually, more and more hospices did start to get PPE and started to open up and say, okay, we can come back in. But you can imagine that coming in without adequate PPE just wouldn't be an acceptable situation. So that was a real challenge in the beginning. And I know, and family, the paid caregivers, again, for those who are lucky enough to have support from paid caregivers, again, a lot of those paid caregivers who are women, minorities, they themselves are caregivers, so in their own personal lives. So there was just this explosion of stress on those people, and of course they putting themselves at risk to come into other people's homes. I mean, the stresses were just so profound and so diverse and so big and multifactorial that I think this is part of this crisis that was compounded by COVID.
We have a lot of people asking how they can share the film with others and where they can seek it out to have additional audience. What's the easiest way to find the film outside of this festival?
It's a great, we're in, people should sign up, should go to our website, caregiverlovestory.com for further information. We are wanting to make it available to as many people as possible. We're working with a variety, we're talking to many different national organizations to try to distribute it to their members. And we are going to be making more announcements soon. It's just this whole rolling out of a documentary and trying to get the most impact is a complicated business I'm learning. So please come to caregiverlovestory.com, and that will be, if people are interested in bringing it to their organization, we also have an email, caregiver@jessicazitter.com, for people who want to arrange a screening. But you'll see on our website, we've got several ways of seeing the film.
You know, right now it's really hard to help anyone, right, outside of your own home. And I'm sure there are many people who have others in their lives that they wish they could be present with. One of the nicest things a friend did for me back in the day was to sign me up for a support group at Facing Cancer Together, which is a local, organization that has many different, I was in a caregiver support group, and most of us just sat around in a circle and stared at each other because we were very tired, but it was nice to just stare at each other when we did. But what can we do for others, especially during the time of COVID, to make caregivers feel supported? There's that a lot of people have written about, asking what can I do is sometimes annoying, right? It's like, just do the thing. But what is the thing you would say to somebody, if you know someone is caring for a family member, for a loved one, what should we do for them right now?
I think the main thing to do is to, if you're in a community, I think it can be even very powerful. Try to get some committee started so that you start identifying the caregivers in your community. And I would recommend this concept of homegrown help. In fact, um, making a list of all of the types of chores, they're unique to each particular caregiver, that are important to them, things that could be delegated. I mean, Rick says at one point in the film, I can't have somebody else put her on the commode. Okay, so don't have someone else put her on the commode. But what are some of the things that could be delegated? Cleaning out your fridge, figuring out, how to do a load of laundry. There was plenty of laundry to be done. There's some really easy tasks, and every caregiver is going to be different. So I think asking them what kinds of things, maybe providing them a list of some suggestions and some other lines, and what else might be helpful that you will feel comfortable delegating to us. We don't even necessarily need to come into your house, but how will this work for you, is a really good way to start. I think that there's several national, there's a bunch of caregiving organizations that I think people should know about, and I'm going to send you a list of those so that people can at least get started looking online and trying to find out what existing resources might be in their communities.
This is so wonderful. And I have one more question. And then, just so everybody knows, all of this information will be in a thank you email that you will receive. So you will not be without it. But you have two subjects in this film who are incredibly self-aware about the conversation they're having, where, she knows, she knows what she wants to do. And a lot of times I hear from friends that they're dealing with loved ones, parents, who don't want to acknowledge that death is even a part of life. And I think that could be many different things, right? How you were raised, religion, age, if you are dealing with someone who's afraid to have the conversation, because so many of these conversations should probably happen earlier than they do, right?
Ugh.
Are there ways that we can get tools to have conversations like that with people in our lives who may not feel so comfortable?
What I learned about this movie, and by the way, I just want to mention my amazing co-director, Kevin Gordon, who isn't here, but did just an amazing job. And he was the one who showed me that this was about something else other than what I thought it was. So thank you, Kevin. Um, yeah, I think that it's, oh my goodness, I just completely remind me what your question was.
Just sort of about starting conversations
Oh
about,
yeah, right.
yeah.
Sorry about that. It's one of those mornings. This is no different from any other kind of advanced care planning. We talk about advanced care planning and advanced directives, and we always are referring to what's happening in the intensive care unit. Are we going to use a ventilator? Are we not use a ventilator? Are we going to use feeding tubes or not going to use feeding tubes? This is another type of advanced care planning that is essential. And I think, if anything came out of this film, it's a sign, it's a messaging about the importance of thinking about these things in advance to every family. You need to talk about, I need to talk to my parents about how they're going to want to be cared for and figure out what's going to work for me, and talk to my sister about how we're going to coordinate. These kinds of plans, if done in advance, my parents are healthy right now, but it's going to make everything less emotional, and it's going to make it more likely that we're going to achieve our goals if we talk about them in advance. And the same thing goes for ventilators and all of those other things that we typically think about as advanced care planning. So one of the, I don't have a special magic wand. I do think that playing a game like Go Wish, for example, can be a good conversation starter. GoWish.org. If you go look at it, you'll see it's just a pack of cards that helps people talk about what's really important to them in life and how they want to live. And then it can be a jumping off point to talk about ventilators and to talk about what your plan is going to be for caring at home, if that's going to happen in your family. So I really just can't emphasize enough to everybody, please think about these things in advance. They're real. You don't want them to take you by surprise. They can be hypothetical, but they should still be talked about in some form in your family, in order for it to go as well as possible.
Well, Dr. Zer, I want to thank you so much for joining us today, and also for making this film that, again, I'm sure many people saw themselves in this story or saw someone they loved in this story. And you've also given us some good homework, which is that, this doesn't end when it ends for us. Like, there are ways we can help people in the community. I'm going to leave this by thinking about, who do I know who is in a difficult situation right now in terms of the people in their home, the people in their lives. Um, what can I be baking and what laundry can I be doing? I think that's a question that I know for me, when other people stepped in that way, it was worth more than they'll ever know. So I want to thank you for shedding light on this issue and continuing to be an advocate for some real structural help in the world, because especially now, I think we're all realizing that if we're not in it together, where are we? So I want to thank everyone who came today and who supports GlobeDocs, because it's through a program like this that I get to see so many different parts of the world and learn about so many important issues and celebrate incredibly talented and thoughtful filmmakers, like the one we're speaking to today, and Kevin. So please thank him too. Again, you're going to get a thank you email with a lot of information and links. And thank you all for coming today.
Thank you for having me, Meredith. This was absolutely fantastic and such an honor. Such an honor.